today's topic is the pancreas. So it is also one of the important organ in the abdomen, and it mainly involves in the glucose regulation, secretion. We will be seeing the function of it. So the pancreas is an exoendocrine gland. Exoendocrine gland in the sense it performs the function of exocrine gland as well as the endocrine gland. As the exocrine function is to produce the pancreatic juice. This pancreatic juice involves in the digestion process, whereas endocrine pancreas just produces the hormone such as glycagon, insulin. uh, it has four types of cells, right? So alpha cells, beta cells, gamma and polypeptide cells. So glycogen and insulin are secreted by the alpha and beta cells. So these hormones involves in the regulation of the glucose level. So coming to the location of the pancreas, first we have to speak about the region in the abdomen. So it is located in the epigastric region and left hypochondrium. So as we know, the pancreas will be located in the concavity of the duodenum. See, so it occupies the epigastric and left hypochondrium regions. And coming to the vertebra, it lies opposite to the T12 to L3. T12 to L3. So coming to the shape, it is red rod shape and size is the 12 to 15 centimeter in length, whereas breadth 3 to 4, thickness 2 to 3.5. So as we know, length is larger, breadth is smaller than the length, thickness is smaller than the breadth. Just remember as such. Coming to the parts of the pancreas, we have head, neck, body, tail. So here we have the duodenum. So in the concavity of the duodenum, the pancreas is located. Okay. So these are the parts of the pancreas. Coming to the relations, we have to speak about the peritoneal relation and visceral relation. Peritoneal relation, normally the anterior surface of the pancreas is covered by peritoneum, whereas posterior it is not covered by the peritoneum. So we can say it is a retroperitoneal organ, but tail is intraperitoneal. Tail is located inside the peritoneum, remaining parts it's outside the peritoneum. So we can say it is a retroperitoneal organ, but tail is intraperitoneal. Okay. Coming to the visceral relations, we will be speaking about the visceral relation according to its parts. Coming first part, head of the pancreas. Superiorly we have first part of the duodenum. As I said, the concavity of the duodenum is presented around the head of the pancreas. So first superior part, we have first part of the duodenum and superior pancreatico-duodenal artery. So this artery is a branch from the gastroduodenal artery. As we know, the gastroduodenal artery is more related to the duodenum. So the first part of the duodenum is presented above the head of the pancreas. So the vessels related to it is also presented. So superior pancreatico-duodenal artery is also presented. Coming to the inferior third part of the duodenum. In third part of the duodenum, what vessel is involved? Inferior pancreatico-duodenal artery. Okay, these are the main relations. Coming to the right lateral, second part of the duodenum will be presented. Right lateral in the sense, so this is the pancreas. We are seeing the head of the pancreas relation. Okay, so this is superior, this is inferior, this is right lateral. Okay, so this is the right lateral. Right lateral, it is related to the second part of the duodenum. Inferiorly third part, superiorly first part of the duodenum. Okay, so coming to the right lateral relation, we have the second part of the duodenum and branches of the superior and inferior pancreatico-duodenal arteries. So as we know, the superior and inferior pancreatico-duodenal artery divides into anterior and posterior and get anastomosis. Okay, So that taking place in the right lateral side of the head of the pancreas, that is second part of the duodenum. In the anteriorly, we have gastroduodenal artery and transverse mesocolon. So as I said, the superior pancreatico and inferior pancreatico-duodenal artery is a branch, superior is only the branch from the gastroduodenal artery. Inferior pancreatico-duodenal artery is a branch of superior mesenteric artery. So as the superior part involves the superior pancreatico-duodenal artery, is a branch of gastroduodenal artery. So anteriorly we have gastroduodenal artery and transverse mesocolon is present. Posteriorly we have IVC, bile duct, left renal vein. Okay. Coming to the neck of the pancreas, we have anterior, posterior, upper border and lower border. These are the external features of the neck of the pancreas. Coming to the anterior relation, it is morely related to the pylorus of the stomach. Pylorus of the stomach, anterior. Posterior portal vein will be located. Upper border, first part of the duodenum, lower border, root of the mesentery. So these are the relations of the neck. See, anteriorly we have pylorus of the stomach. Anterior, first part of the duodenum starts from the head of the pancreas, whereas in the neck, the duodenum superior part is the pylorus of the stomach continues as the duodenum. So to be prior to the first part of the duodenum is the pylorus part. So the anterior to the neck of the pancreas is the pylorus part of the stomach. Whereas posteriorly we have portal vein. Upper border is related to the first part of the duodenum. Lower border is related to the root of the mesentery, where the mesentery is going to be start. So coming to the body of the pancreas. So this is the body of the pancreas. Okay. So here we have three borders: superior border, anterior border, inferior border. We have three surface: anterior surface, posterior surface, inferior surface. Okay. Coming to the border, superior border is related to the hepatic artery. Anterior border is related to the transverse mesocolon and inferior border is related to the superior mesenteric vessels. So inferior border. In the inferior border, we have the third part of the duodenum will be related. So in the third part of the duodenum, what vessels will be related? Superior mesenteric vessels. So in the inferior border of the pancreas, superior mesenteric vessels will be related. So coming to the surface, we have anterior surface which is related to the stomach and the lysessa. Okay. Posterior surface is related to the left kidney and left suprarenal gland, and inferior surface coils of the jejunum. As we know, stomach is a left organ, so anterior surface is related to stomach. So posterior surface is related to the left kidney and left suprarenal. Okay. So coming to the tail of the pancreas, it is related to the spleen, and it contains numerous islets of Langerhans which secretes the hormone. It is presented in the lienorenal ligament. As we know, the tail of the pancreas is located in the lienorenal ligament along with the splenic artery. Coming to the blood supply of the pancreas, we have three main arteries: splenic artery, superior pancreatico-duodenal artery, inferior pancreatico-duodenal artery. As I said, superior pancreatico-duodenal artery is a branch of gastroduodenal. Inferior, superior mesenteric artery. Okay, whereas splenic artery is a branch of celiac trunk. It's a direct from the celiac trunk. So celiac trunk comes from the abdominal aorta. So these are the blood supply of the pancreas. Coming to the venous drainage, normally pancreatic vein drains into the portal vein, splenic vein, superior mesenteric vein, the vein which is presented around the pancreas. Coming to the nerve supply, we have sympathetic and parasympathetic. Sympathetic is T6 to T10 spinal segments, whereas parasympathetic is vagus nerve. Okay. So coming to the duct of the pancreas, we have two ducts, that is Wurmstrang and Santorini. Wurmstrang is the main pancreatic duct. Santorini is an accessory pancreatic duct. So these drugs drain into the second part of the duodenum and secretes the pancreatic juice. Coming to the applied aspect, we have carcinoma of the pancreas and pancreatitis. Carcinoma of the pancreas is mainly occurs in the head of the pancreas. When the head of the pancreas just enlarges, this head of the pancreas is just related to the duodenum. So in the second part, as we know, the bile duct will be presented or related. So when the head of the pancreas just get enlarged due to the carcinoma, it may block the bile duct, and that leads to the obstructive jaundice. So when the bile duct is not when the bile is not released from the bile duct, it leads to the jaundice, that too particularly obstructive jaundice. Okay, so coming to the pancreas, it is inflammation of the pancreas. So where the autodigestion of the gland will be taking place, which is a serious condition, and the serum amylase will be increased, because when there is damage to the gland, the secretion will be increased. So these are the applied aspect or clinical significance of the pancreas. So thank you.